Hi, I'm Kate Mulligan, and I'm going to tell you a bit of a story of my own experience with social prescribing. Earlier this year, one of my 9-year-old daughters suffered a life-threatening brain infection. She needed emergency surgery twice. In the months of rehabilitation that followed, I experienced firsthand the power of social prescribing, non-clinical supports for health that are related to health-related social needs. I experienced this in her life and in my own life as her caregiver. Artists and pets visited her hospital room. Peers from all walks of life and all kinds of abilities taught her inclusive ways to participate in sports and games. Chefs prepared food she liked and wanted to eat. An accessible school and a garden and a gym and an art studio all were part of the built environment around her. And it all went into her electronic medical record. It was counted as health work. For me, other parents and caregivers formed a protective circle of understanding and support through our shared experiences. Despite how difficult it was and is for Orla and for our family, this experience was transformative. It was a space of belonging. But it shouldn't take a near-death experience or a specialized kids rehab hospital to access the basics of community care. The evidence is clear. Non-clinical supports and services that help us with the social and environmental determinants of health are effective, efficient, engaging, and equitable. Social prescribing means having support to find and access these resources, even when we face material or psychological or medical barriers. It means shifting our collective focus from what's the matter with us, the focus of our current sick care system, to what matters to us, and having someone accompany us and keep us company in our journey to well-being. At the Canadian Institute for Social Prescribing, we've spent the last 2 years weaving together a network of people like you from coast to coast to coast who are interested in making this happen in their communities. We've made space for funders and policymakers and students and researchers and healthcare workers and community leaders and equity experts and people with lived and living experience. On our website at socialprescribing.ca, you can see the evidence we've marshaled around how social prescribing works and for whom and under what circumstances. We've shown, for example, that social prescribing has a social return on investment of $4.43 for every government dollar invested. We've brought the direct voices and goals and aspirations of people experiencing loneliness and social isolation into the research and planning for social prescribing. We've learned about how community and social and health organizations can work together and what their hopes and dreams are for social prescribing in this country. We've built highly detailed evidence maps about what is known and what is yet to be known about the impacts and processes of social prescribing. We've conducted policy research to understand how social prescribing is finding its way to new places, how each initiative works with people to co-produce well-being, and how social prescribing can help us contribute to broader social goals. And we've seen social prescribing grow in every single province across the country. It's not going back in the bottle. So I'm very, very pleased to have all of you with us today to learn more about how social prescribing can build belonging and better health for all. Thank you.